Hi, I'm Lainey, and I'm going to be doing my NG Passoff. So first I'm going to verify the medical order and that a NG tube has been ordered by my patient's physician. I've gathered my supplies, and now I'm going to enter my patient's room. Hi, sir. My name is Lainey. I'll be your nurse this evening. I'm going to raise your head of the bed so we can have a conversation. Today, your physician has ordered an NG tube to be placed. I am going to verify your name and birthday, okay? So will you tell that to me? Perfect, okay. So that matches his wristband, and it also matches his MAR. So I'm going to proceed with the procedure. All right, sir. So today, like I said, we're going to be placing an NG tube per your physician order. This will help relieve the discomfort that you're having in your abdomen because there's extra air in your stomach. So this is a tube that will go through your nostril and down to your stomach, and it will pump some of that air out, all right? So if you have any questions or concerns, let me know. This procedure will be uncomfortable. You'll experience some mild pain, but I do have some measures to prevent that as we proceed. And if you'll just follow my instructions, it will really help the procedure go smoothly, okay? So I'm going to raise the head of the bed about 45-degree angle. At a 45-degree angle, I'm going to look at his nostrils. Yeah, it looks like the right one looks more appropriate, but I am going to ask my patient, sir, is there a nostril that you feel you breathe better out of? Take a big deep breath and see what feels best. Okay, yeah, so his left nostril is his stronger nostril, so I'm going to insert it into the right one. Okay, so now I'm going to place my supplies over his chest, which will be this pad. All right, so this is just going to catch any fluid or anything that comes out while I'm inserting this, okay? Okay, so I'm also going to place this emesis basin right here, just in case. Okay, so now I'm going to measure. I'm going to measure the tube. All right, from the tip of the nose to the ear, and down to my patient's xiphoid process here. Okay, looks like we're at about 46. So I'm going to mark that. Great. That will help me know where I am at while I'm inserting the tube and make sure that I go in far enough, but not too far. All right. So now I'm going to perform hand hygiene, put on clean gloves, and again, I just want to address any concerns or questions my patient has. So do you have any questions or concerns with this procedure? Like I said, your physician ordered it. Do you feel like you understand the reasoning for it? Okay, good. Okay. Got a whole lot of hand sanitizer on my hands. All right, now I'm going to lubricate the tip of this tube. About 2 to 4 inches. Okay, great. All right, so I'm going to ask my patient to lean his head back into his pillow upon insertion. So here I'm looking at the left nostril. I'm going to insert it, and I'm also going to watch for signs of discomfort for my patient, like gagging or coughing, and I would discontinue the procedure and reevaluate the appropriateness at that point. So I'm going to continue. If I felt any resistance, I would twist the tube in my hand, but I would not force it. All right, can you put your chin to your chest now that I've reached the pharynx? All right. So I'm just gonna advance. And now I also want to offer my patient water. So sir, this is one of the comfort things we talked about that will make this procedure more comfortable. Please take some deep sips. He's gonna hold that and drink it while I advance the tube. And now I'm just watching on my tube for the place that I marked. And again, he's still taking sips of the water. Okay, and I'm not forcing it. And I have reached my marker. So now I'm just going to loosely secure my patient's tube to his face while I verify the placement. And that didn't move at all, but I shouldn't have let that go. All right, so that's loosely secured. Now I'm going to check if there's been an x-ray ordered, and there should have been. And I see that on his MAR, so I'm going to obtain a chest x-ray. And great, the results came back, it is in his stomach. I'm also going to take out some gastric contents, and that'll be my second verification of where the tube has been placed. Okay, so now I'm going to take out about 5 milliliters. Okay. All right, and now compare the pH to this. Yeah, it looks like it's between 4 and 5, which is consistent with gastric contents. So I have verified that it is in the right position. All right, so now I'm going to make sure that that's clamped. And now I'm going to more securely place the NG tube. I'll do that by placing it on the bridge of his nose. Holy cow, it's hard with gloves on. I should have taken them off. Sorry about that, John. My fingers keep sticking to the tube. All right, so that's been secured. I'm now going to remove my gloves, perform hand hygiene again, and I'm also going to make sure that it's attached to suction and it's above his shoulder level, okay? All right, great. So he's attached to suction at the prescribed amount, and I'm just going to assess his comfort level again. John, are you feeling okay? Okay, good. So I do want to put on gloves and perform some oral care, and also educate my patient about why oral care is necessary. So when you have a tube, especially with suction, it can cause some dryness to occur in your oral cavity, which is your mouth. And I just want to prevent that and make sure that you feel clean and comfortable. So I'm going to perform oral care and also provide him some chapstick that he can put on as he needs. Okay. And we'll perform this about every 2 hours, but if you need it sooner, then please let us know and I will make sure that that happens, okay? All right. So now I'm going to assist my patient back to a comfortable position and document all of my findings and how my patient responded to this procedure, and remove it when the physician deems it no longer necessary. All right, thank you.